my conversations with her uncle, they've already begun to think of ways that they can honor her and keep other Charlotteans safe. I'll be meeting with them later today to express my condolences in person. No parent, no brother or sister, no one should ever have to experience that kind of trauma. Irina's murder brings up real concerns for people all over North Carolina about the safety of our communities. Everyone deserves to be and feel safe in their home, in their communities, on their way to work or school, in their daily lives. We can and must do more to make sure that we are protecting the people of North Carolina. I urged the mayor last week to surge law enforcement across the public transit system, and I'm grateful that she did. It's a good start, and we have to keep it up. With more public safety on trains and law enforcement in our communities, we can deter criminal activity, and we can start the work of rebuilding trust. We also have to take a close look at our pretrial system and make sure that it is protecting people. The Pretrial Integrity Act, passed by the Republican legislature with bipartisan support by a number of these legislators here today, signed into law by Governor Cooper in 2023, was a good start, and it shows that we can and we should continue to work across the aisle to make progress. We all know that having mental health issues does not equal violence. At the same time, to keep people safe, our judges and magistrates need better training and tools to respond when a defendant's mental health situation and history of violence may create real concerns for public safety. We need to institute mental health risk exams to determine whether those concerns pose a real risk to public safety and to give those people the right place to go for treatment. Of course, we have to have enough mental health practitioners to conduct these exams and enough healthcare facilities to respond to behavioral health needs. As we've seen, magistrates play a weighty and often overlooked role in the criminal justice process. They're working hard to make important decisions under difficult circumstances. In addition to making sure that they have the training that they need, we need to make sure that magistrates have a clear single supervisor who has authority over them through oversight. More accountability, including an unambiguous chain of command, published disciplinary processes, and common sense removal procedures will boost confidence in our system. Some pretrial decisions, such as those where there is a concern about a person's mental health and their history of violence, should be reserved for judges instead of magistrates to determine any release conditions. We also need to respond to mental health crises as effectively as we can. When law enforcement partners with trained mental health professionals to respond to a crisis together, we can better keep people safe, both the public at law and the individual involved. It also relieves pressure on law enforcement so that they have more time to respond to other public safety calls. I want to underscore, we need more well-trained law enforcement officers on the streets keeping us safe. I've been calling for raises for law enforcement for years. We ask them to put themselves in harm's way, and we frequently will express our appreciation to them verbally, and it is time that we put our money where our mouth is. Unfortunately, the General Assembly has not yet passed a full budget this year, but it is not too late to rectify some gaps that have been made painfully clear. In the absence of a full budget, but ahead of their return to Raleigh on Monday, I sent a letter to the leaders of the General Assembly urging them to fund 3 key investments immediately. Public safety is one of them. I continue to call on them to fund my $195 million public safety package. It provides pay raises and recruitment and retention bonuses for state and local law enforcement officers, increases co-responder teams, defends North Carolina's communities from community and school-based violence, creates a cold case unit to deliver justice to survivors of sexual assault, and a unit to combat the fentanyl and opioid crisis. These proposals are about keeping you and your families safe. Later, you'll hear from Kings Mountain Chief Gerald Childress. He's the regional director of the Association of Chiefs of Police. I also call on the legislature to appropriately value our public servants with salary increases, especially given the rising cost of living. That includes our teachers who recently started another school year without a pay raise. Our teachers are among the worst paid in the entire country. Yet they are the number one in-school factor of our students' success. It is long past time that the state of North Carolina gave our teachers a real pay raise. I'm asking the legislature to raise teacher pay by an average of 5.9%, restore master's pay, and give all other school personnel a 3% raise. Soon you will hear from the chair of our State Board of Education, Mr. Eric Davis, who will lay out the needs that we are seeing. I am also calling on the legislature to give our state employees at least a 2% pay increase. We have a 20% vacancy rate across state government. This raise would help us to recruit and retain talented public servants providing important services to our people. Public safety and teacher pay are issues that we cannot keep kicking down the road. Neither is health care, and on health care, we are on the clock. If the legislature does not act on Medicaid by October 1st, the system will be at risk. In July, the General Assembly passed a bill that provided helpful support to the program, but unfortunately, it was not enough to fully fund it. Without additional funding, the Medicaid program will be forced to make painful cuts to the rates that it pays our healthcare professionals, because by law, the system cannot spend money that it does not have. So we find ourselves teetering on the brink of serious cuts. I do not want these cuts to come into effect, and I don't believe that the House or the Senate want these cuts to come into effect. I am confident that a solution exists, and I'm committed to working with our colleagues, both Democratic and Republican in the General Assembly, to achieve that solution. The Office of State Management, Budget and Management, and the Department of Health and Human Services, nonpartisan actuaries and economists project that we need $319 million to fully fund the program and protect critical health care services. DHHS and my administration have been in talks with legislators about how we can get more funding and avoid these damaging cuts. We will continue those good faith efforts to find a solution. If the legislature passes the full amount needed, we can avoid these cuts altogether. If the legislature appropriates a lesser amount, the amount recommended by its own Fiscal Research Division, DHHS can delay the cuts and work with the legislature on longer-term solutions to tackle the rising cost of health care. But the money needed to delay these cuts is needed now. It cannot wait until next month. If the General Assembly does not take action now, the cuts to people's health care and to essential health care providers will be devastating. Carolyn Allison, who's CEO of the Charlotte Community Health Clinic, will speak later about this devastation. I'm encouraged by the conversations we've been having with the legislature as recently as yesterday. There is a straightforward path to a clean Medicaid bill. I want to reiterate, I do not want these cuts to happen. I do not believe that the legislature wants these cuts to happen. So let's do the work this week and next to ensure that these cuts do not happen. Let's pass a fiscally responsible budget that makes the investments we need in this state, whether it's stopping the health care cuts, paying people what they are worth for the work that they provide our citizens, and making sure that people are safe and can go about their lives without fear. Thank you. I want to thank these legislators for being here and the hard work they do at the General Assembly on our behalf. And at this point, it's my pleasure to bring forward Chief Childress, Kings Mountain. Chief.
Thank you, Governor Stein, for the opportunity to be here today to speak on behalf of the North Carolina Association of Chiefs of Police. Across North Carolina, communities large and small are facing growing crisis. Our police departments are struggling to fill vacancies, and the men and women who remain are stretched thinner every day. These vacancies don't just affect law enforcement, they affect the safety and peace of mind of every family in our state. The overarching problem, many police departments across the state, whether they're rural communities or towns, larger towns, are running short-staffed. Open positions remain unfilled for months, sometimes even years. The officers who remain are working long hours, often covering multiple shifts, just to ensure the basic services are met. While our officers are committed and dedicated, no amount of commitment can replace the need for adequate staffing. And this is where the real issue lies. This isn't simply a staffing problem, it is a public safety problem and touches every single person who dials 911 for help. When vacancies pile up, dangerous gaps appear. Response times to emergencies get longer, proactive policing cease to exist, and those efforts to prevent crime before it happens cannot do it. It takes back, and as officers are asking to do more with less, fatigue sets in. Tired officers are more likely to make mistakes, and burnout drives many to leave the profession earlier than planned. The consequences don't stop at slower response times. Vacancies hinder our ability to address violent crime, drug activity, and traffic enforcement. Victims may experience delays in investigations, which can feel like justice denied. And perhaps the most troubling, criminals pay attention. When they perceive the police presence is weakened, they feel emboldened. That perception alone puts communities at greater risk. This is just not a police problem, it's a community problem. It is a citizen problem, and it demands our attention. So what is the role of legislature? This is where the state leaders comes in. Public safety requires investment. If we want stronger, well-staffed police departments, the state must provide consistent, dedicated funding to recruit, retain, and train our officers. Competitive pay and benefits are not luxuries. They are necessities if we want to attract and keep good people in this profession. Just as important, officers need access to strong training, mental health resources, and modern equipment to allow them to do their jobs effectively. Public safety is not an option. It is not a side issue. It is a fundamental duty of government. And when government fails to support law enforcement, it fails its people. This is the moment for leadership. We need our legislators to recognize law enforcement vacancies across the state as an emergency. We need bipartisan support to fund local police departments and ensure that every community, from mountains to the coast, has the protection it deserves. When we invest in public safety, we invest in stronger families, we invest in safer neighborhoods, we invest in a North Carolina where businesses thrive, children grow, and citizens live without fear. So the time to act is now, because when it comes to safety, delay is dangerous, and inaction is unacceptable. Together, let's call on our leaders to make public safety a priority for today and for the future in North Carolina. This time I'd like to turn it over to Chairman Davis.
Thank you. Thank you, Governor, for being here today and for being a champion for North Carolina citizens. We appreciate your leadership on these three critical issues that we face. And on behalf of my colleagues on the State Board of Education, we wholeheartedly support your proposal for paying state employees, particularly our teachers. And here's why. There's at least three universal truths about increasing teacher pay. First, There's only one profession upon which all other professions and all other lines of work rely upon, and that's the profession of teaching. So if you want a good mechanic, good electrician, a good plumber, good doctor, dentist, or nurse, invest in public school teachers, because that's where your doctors, mechanics, electricians are coming from. Second, plays out in every time we make a purchase, whether you're buying a new set of shoes, going to a meal in a restaurant, or going to the grocery store. We get what we pay for. Increasing teacher pay will ensure that we have the opportunity to recruit and retain the high-quality professional teachers that your children, our children, deserve. And third, I haven't met a parent yet who is satisfied with anything less than the best for their children. They certainly don't want their child's teacher to be worried about making the next mortgage payment, or having to work 2 or 3 jobs, as so many of our teachers have to do just to survive on the paltry pay they're paid today. No, they want what's best for their children, and so do we. That's why we're determined to make North Carolina the best it can be, based on creating the best schools in the nation. And a critical step in that regard is to pay teachers a competitive wage, which enables us to compete for their talents against all the other opportunities that our state offers. You know, the past year, our terrific public school teachers enabled our students collectively to increase their academic achievement on 12 of the 15 end-of-year tests that we administer each year. They also enabled our teachers and our students to achieve the highest graduation rate in our state's history. Our teachers are worth investing in. And so we applaud the governor, we support this effort, and we call on the General Assembly to meet the needs of North Carolina's communities and citizens. Investing in public school teachers is the best investment you can make in North Carolina. And I'll turn to Ms. Allison.
I'm sorry. I
I'm
had to.
glad you did that.
I had to. I know. It's like, amen to
absolutely
that. Yeah. Good afternoon, everyone. Thank you, Governor Stein, for having me out here. My name is Carolyn Allison, and I have the honor of serving as CEO of the Charlotte Community Health Clinic, a federally qualified health center here in Charlotte. I'm also the board chair for the North Carolina Community Health Center Association. Community health centers and Medicaid are celebrating its 60-year anniversary. Let me repeat that, its 60-year anniversary. Started together in 1965 during the war on poverty, etc. Community health centers are the largest primary care system in North Carolina. At Charlotte Community Health Clinic, we provide medical, dental, behavioral health, and pharmacy services to thousands of families across Mecklenburg County. No matter their insurance status, if they're on Medicaid, Medicare, private insurance, or their ability to pay. If you're uninsured, please come, you can come. We have like a sliding scale, and that's all community health centers. We are proud to be part of North Carolina's network of 43 community health centers, or some know us as federally qualified health centers, or FQHCs. FQHCs here in North Carolina are serving 800,000 patients in 92 counties and at more than 700 sites. Also, 1 out of every 10 rural North Carolinian gets their care from a community health center. 1 out of every 10 rural North Carolinians get their care from a community health center. So we're everywhere, guys. The community health center model is a simple one and powerful. Coordinated, comprehensive medical care and keeps people healthy, prevents unnecessary ER visits and hospitalization, and lowers overall cost for the state. But that model is at risk. On October 1st, unless the General Assembly finalizes the Medicaid budget rebase, a 3% cut to provider reimbursements will go into effect. For community health centers like ours, that is not just a number on the page. It threatens access to care for Medicaid patients and for all North Carolinians. Just last month, a young mother came to our clinic with her 2 children. Thanks to Medicaid expansion, she was able to have her care covered and the care of her children covered. Without stable Medicaid funding, families like hers are risking losing this lifeline. And that's something very important. North Carolina community health centers are already operating on razor-thin margins. Medicaid reimbursements are what allows us to keep our doors open and maintain our workforce and provide integrated services like dental, behavioral health, and pharmacy services. Cuts mean longer wait times in the doctor's office, fewer services, and fewer staff. And the impact ripples across the system. Our patients also rely on hospitals, nursing homes, dentists, and specialists who face the same cuts. So I'm not just here talking about community health centers because obviously it's a system of care. So our patients are dependent upon the entire system. Here in Mecklenburg County, more than 340,000 people, nearly 1 in 3 residents, are enrolled in Medicaid. Thanks to expansion, more people than ever before are finally getting the health care they've gone without for years. We cannot afford to turn back the clock on this. We just can't. We are deeply grateful to Governor Stein, Speaker Hall, President Pro Tem Berger, and the legislative leaders in both chambers for recognizing the urgency of this issue and for supporting more funding, not less, for Medicaid providers. We know there is a consensus to prevent these cuts. Now let's just get it done. North Carolina Medicaid provides affordable health care to more than 3 million children, older adults, people living with disabilities, and other working adults. And over 650,000 could lose that lifeline. I urge the House and Senate to come to an agreement quickly before October 1st. Our patients, our providers, and our community are counting on all of us. Thank you for this time. Appreciate it.
Morgan, can you fix this microphone, please?
This question. While we, I'm gonna let you fix this. While we wait, there's a lot of y'all, a little bit of time. So as folks will say your name, your outlet, try to get everybody a question, but I can't guarantee that, but just, be kind to each other. And if you will repeat the question so everybody can hear them.
Sure. And you,
Governor Andy Weber with Queen City News. Based off the press conference last week, do you think that the state should resume executions of the death penalty here in North Carolina?
the death penalty is a serious penalty that should be reserved for those who commit truly heinous crimes. It is the law of the land in North Carolina, and there are some lawsuits where the courts have been holding it up, and we have to go through that legal process.
Should they resume it?
Consistent with whatever the courts order, of course.
Alexandria Sands with Axios. I just wanted to ask, what have conversations been like with those leaders, Berger and Hall, if you've had any, and how are you feeling about what they're proposing?
They've been very constructive conversations with the leadership and the appropriations chairs. I genuinely believe that neither chamber wants these cuts to go into effect. They have differences of approach, they have differences of priority, but we need to get this done. We cannot allow our differences to get in the way of providing health care to North Carolinians and ensuring that the professionals who provide that care get adequately compensated.
Dedrick Russell with WBTV. What have you heard about federal government coming here to do a subcommittee meeting talking about violence, and we all know about National Guard going into cities. What do you know about that, and what is your response to that?
Yeah, I mean, I just know what I read in the paper, that there was some interest of a House subcommittee looking into the situation. What we need to have safe communities is to have more well-trained professional law enforcement officers in our communities, proactively policing. When they're out and about, criminals don't act. So what I want to see is more well-trained officers. We don't need soldiers on our streets. Let's use that money that's very expensive and actually apply it to making sure we have more law enforcement officers who can serve our community, deter crime, and hold those who commit crime accountable.
Yeah, how about the Illinois governor pushed back and National Guard did not go to Chicago? So what is your strategy, and have you had those conversations, and what would be your strategy to push back and not have that National Guard come to Charlotte?
Well, we're in the middle of hurricane season, and I actually 2 or 3 weeks ago had to deploy the National Guard out to the Outer Banks in advance of Hurricane Aaron. Fortunately, it was further offshore and didn't create widespread damage, but let's have the National Guard focus on what the job of the National Guard is. Let's not have them do law enforcement when we have law enforcement officers to do that work. We just need to pay them appropriately.
Casey Jones, WCCB News. The Mecklenburg County District Attorney expressed a gap in the system where he says that after a person is found mentally unfit to stand trial, they are often sent right back to the streets. Where do the legislative priorities need to be in terms of mental health to make sure that those people don't end up back on the streets?
It's very important that we have, for those folks who have clear mental health, psychoses, and a history of violence, that we have some test, some evaluation mechanism to determine what their risk is and then act accordingly. There are reforms that we can do to the involuntary commitment statute in North Carolina. Obviously, we don't want to deprive people of their liberty without thorough due process, but there are times when a person is a real risk to other people or to themselves where that is the appropriate resolution.
Republicans are blaming
Can we stick to
policies
one question?
like...
I'm so sorry.
Yeah, thank you. Governor Evan Donovan, WSOC Channel 9. I just want to follow up on that right there, because your proposals today and your initial tweet after when you first talked about Irina Zurska's murder mentioned policing. But a lot of people, there was some criticism of that because this suspect was arrested at least a dozen times. Do you see this as more of a mental health issue? Do you plan to ask the legislature for more funding for state mental health facilities or mental health care? And what changes specifically, since you just mentioned it, would you make to the involuntary commitment law?
Yeah, well, the issue has to do with when you have somebody who has been arrested for a crime, and the crimes that he was arrested for were misdemeanors later. Some of them were violent offenses, and he had sentenced to prison for one of those violent offenses. But it was for misusing the 911 system. But that person came before a magistrate, and it was clear that there were issues that needed addressing. If we had a mental health evaluation exam to see whether that person posed a risk, then the magistrate could have authority to preventative detain him to keep him from entering the community and causing harm.
But where would we send
Sorry,
him
one
knowing
more-
that?
sorry, one
Say-
more.
That's one reason why Medicaid is a part of this conversation, because a lot of our mental health care services are provided through Medicaid, and we have to have a strong, robust health care system that serves both people's physical needs but also people's mental health needs. And so going backwards on Medicaid is exactly the wrong direction when we need to go forward and provide more health care to people in need.
Governor Stein, Julie Kay with WCNC Charlotte. Our local government here at the city and county level has been criticized for how long it took to respond and put some safety precautions in place on the train system. What's your response to how the local government has responded?
Yeah. I think everybody wishes that we'd been more on our toes and the local government had been more on its toes. I'm gratified that the local government has surged law enforcement and safety officials on the transit system. They've increased the number of people doing that work. They've also increased deployment of technology at the train station so they can use that to promote a sense of safety and security. I know that the local government cares deeply about this city. They care deeply about the people of the city. They're working hard to provide the best services they possibly can, to have the strongest, most vibrant economy with good paying jobs as they can. But every one of us in public life wants to do better. And I'm sure that they would say they want to do better.
Anyone else have a question? Okay, I'll check it.
Republicans are blaming policies, specific measures like cashless bail and raise the age for the rise in violent crime. Are there any specific state laws that you believe maybe need to be reevaluated based on current crime trends in the state?
There was a bill that was passed a couple of years ago to look at pretrial release policies, and the legislature, on a bipartisan basis, strengthened those policies. I think we should review them and determine when you have the intersection between a crime that may not have been itself a violent crime, but you have a person who has a history of violence, to then have a different process for that person to make sure they don't slip through the cracks.
All right, thank you, everybody. I'm so sorry you have to get to another meeting, but if you do have additional questions, as you know, you can email govpress@nc.gov.
Thank you all.
Thank you so much.
Good to see you all. Appreciate you being here.
Questions and answers.